screen. Can you see my screen? If you
Yes.
take your screen off, then I will share my screen.
Yes, sir, we can
Sir,
see
your
you.
screen is visible, sir.
Right. If my screen is visible, then good afternoon to all the die-hard supporters who have joined today. And what I will do in the next 10 odd minutes is to try and take you through why we are doing what we are doing and how we need to look at the resident welfare associations, our neighbors, our friends, our peer groups, all working together. And I'll just go back to around the later part of the 20th century and the last 2 decades of this century. Over the last 40 years, we have seen a big change in the way infectious diseases spread. And the big change is, unlike the previous infectious diseases, which were there for a long time, you look at a condition like malaria, look at cholera, compared to them, the more recent ones, specifically those in the last 2 decades of the last century and the first 2 decades of this century, have shown that human behavior plays a major role in the spread and control of infections. And if we have to look at the spread and control of the new infections or the emerging infections, and we have to look at behavior, one of the important things to do is working together as a community. Whether it has been swine flu earlier, whether it has been COVID-19 now, or dengue within the COVID-19 era, you find that human behavior, specifically group behavior, has a lot to do and a lot to contribute to control, which is why we are looking at introducing and launching the RWA Do It Yourself Guide. Many volunteers have already seen some of these things that have worked well in the past, but now it is for the wider groups, even if they're not directly volunteering, they need to know how they need to act. And the reason for that again is critical because of the deluge that we had last week. The deluge, prior to the deluge, everybody thought that this year is only going to be a COVID year and we would not have much about dengue. But unfortunately, the deluge has left a lot of areas inundated with stagnant, dirty water. And it is the stagnant, dirty water collections which the Aedes prefers to breed in. And the water has not dried up across Hyderabad. The entire city still has water collections. It's exactly water collected. So right now is the time when the Aedes is coming up and saying, look, your Dashera can only be successful if you eliminate me. And if we have to look at that, then we have to look at working as groups. So the purpose of this guide that has been developed is for the use of the residents, the societies, associations, so that it can increase the awareness and provide the information on how one could reduce the mosquito menace and control dengue in their own residences, around their residences, as well as at their work premises. It's very simple to use. It's a very short guide, about 10 pages, which has a lot of pictorials along with the textual evidence-based information. And there are annexures which will give you additional information. And this guide would help you in gaining knowledge, how you could do things yourself so that you could fight the dengue menace effectively. And the sort of work that can be done, the tasks can either be done individually or by groups, your own peers or members within the community. It's very easy to follow and the steps have been laid out in such a manner so that there is no confusion as to how to undertake these activities. We need to be able to have the skill to respond to any individual who has fever at home, and this guide will help you with that. We also have details on the control room that has been set up to support, as well as any training that you may require for the RWA members. Please reach out to the control room and they would help in that. The content has been laid out in such a fashion that it is easy to go through. It's about what this mosquito is about, how the disease is transmitted, and what can be done by the RWAs and what the control room can do to support them. Tasks to be done, how they could do it, and the sort of resources that may be required are all very lucidly set out in this kit that is being released today. We are looking at the next 7 weeks as very critical for the dengue cycle in Hyderabad and the surrounding areas. So 7 activities every seventh day for 7 weeks. That should be the motto, which would help us to see that in the time of COVID, we do not come up with another major conflagration of dengue. Organizing awareness meetings, and we are very happy to help in that. Getting your housekeeping staff, increasing their awareness and knowledge, organizing weekly activities, organizing collective action, using attractive toxic sugar baits, use of impregnated door and window curtains and meshes, and wherever possible, bed nets, and using personal protection. The seventh one is the support that GHMC as well as the control room can provide on how one could use larvicides like Temifos, fish like Gambusia and guppy fish, which are ecologically or environmental friendly, and outdoor insecticide spraying, which unfortunately is not a very environmental friendly method. Above all, if you see or come across any fever, support the residents on managing them and referring them to the appropriate location. The sort of activities that we would be very happy to support includes cleaning the containers so that the stagnant water could be removed, using insecticides, like I mentioned, breeding small fish, which can be very helpful as larvicides, setting up mosquito traps or sugar baits so the adults are attracted and then we eliminate them, just like the arrows. How one can dispose of water containers, clear clogged drains, use of mosquito repellents, clothing that should be worn, and closing windows and using meshes. So these have been methods that we've talked about earlier, but just in case you need any support, please reach out to us. There is a mosquito control kit which has been prepared, which has a number of ingredients, and here you can say 13 ingredients listed there, which should have the mosquito repellent so that you can protect yourselves and when you step out, and even within the confines of the house, a mosquito repellent is critical. The mosquito repellent is not just outside, but even within the house, because the Aedes is a day biter. How to prepare sugar baits and what goes into them. Example, boric acid here. Temifos as a larvicide, a siphon pump so that small collections of water can be drained off, insecticide impregnated or treated nets, and a bucket and tumbler, a stainer with a long handle, an opaque PVC sheet, safety fluorescent vest for you to wear, masks, reusable gloves, and hand sanitizers. In addition, if the welfare organizations or associations are interested in an ultra low volume insecticide spray machine, then we are happy to help them procure it and share the details. Similarly, if you need help with procuring Gambusia fish, which GHMC gives free of cost, it is just the transportation, we can also help you in providing that information and also to help your housekeeping staff. We have been working with the RWAs over the last 10 weeks, and this is on the top. You find the activities which volunteers and RWAs have been doing to get rid of the breeding locations. And whenever there was a distress call or an SOS call placed to the GHMC, immediately they responded. They have an excellent team there, and they have been there right on the spot, helping the RWAs get rid of mosquito breeding places. So next would be Dr. Samiksha as to what sort of support would be offered to the RWAs. And we are there is what we want to say. And the guide that I have just presented is there for all of you to use, very easy to go through and will help you. Over to you, Dr. Samiksha.
Thank you, Professor Murthy. I'm so delighted that we all could put our experience into a form of a guide. And this guide actually have feedback from all the volunteers and the RWs, what they have been using, keeping their inputs into it. So it would be really handy and easy tool for everyone to start. Even for student volunteers, it's an easy read to gain knowledge, and also ask your parents and RWA representatives to see and read through this guide, and you students can motivate adults to take up these tasks. We are there to support you. And in this slide, before I move on to what kind of support we can offer, please note that we are available on Telegram and WhatsApp. The number has been repeatedly shared with you. You can note the number from here, as well as we'll put it again in the chat. We always put it in the chat every time we have these webinars. You can write to us. It's simple, Project No Fever at iiphh.org. That's for our institute. And we are also starting our website, Project No Fever, on the occasion of Dashera. So all these webinars we have had so far will be uploaded on the website. Even the guides and the more information you would require would be uploaded on the website. So you can also get the information there. So now what we can offer you.
Should I continue with the slide share, Samiksha? I can move it forward if you want.
Sir, I've already shared my slides. Okay, so thank you, sir. I've moved on with this. Great. So this is last slide, but not less, because we have been trying to support RWAs and volunteers through a lot of webinars. And those who know it, they know that we have these services available, but who are new, we'll reiterate it. And so when RWAs will be taking their task, when we'll be reaching out to them, they will be engaging their residents in the society, in the colony, their friends and neighbors. So in the process of this program, we have developed a lot of flyers, pamphlets, information brochures, do-it-yourself guide, such as which are releasing now. And the do-it-yourself guides will also be prepared for a few school students, then for housekeeping staff or housekeeping agencies. We are going to target these housekeeping agencies who provide services in large offices and societies, residential societies. So we will have series of these guides. The first one has been released today, which is a handy guide. We do have some videos where we show how the activities can be done. For example, how to make a Stemiphos solution, where all to spray it, how to make a sugar bait. So similar kind of videos. A lot of these are already available on YouTube channel. Our YouTube channel, the details of it is also in the guide. And if you go through the guide, which we'll share with you shortly in a PDF form, we have also listed all these videos and the YouTube links to those videos. So those things are readily available for you. You just have to go to page number 10, I guess, and there you will have all the list of these activities, of this awareness communication material. Apart from this, if you would need anything more, that will be available on our website, or you can write to us on the number given below. Then we are here to offer training and any capacity building support you want. As I said, we do webinars. Many of them are already there on the YouTube. You can go back to them. In case you want to have your own personalized training and sensitization for your own of the management or housekeeping or for the residents, we will be available and we can conduct webinars for 2-3 societies together so that we reach out in a more personalized manner, but to a larger pool of residents. We often, for few activities which require a little more than just reading the script, we also do demonstrations. And if need be, our representatives would be also willing to travel to your society and maybe give a spot check for you and any other handy information you may require. So that's also will be provided through the Project No Fever team. As you already said, have seen, and Dr. Murthy has described in detail that we have arranged a kit, which is a tool to be able to do all the activities that we enlist. Most of this components in the kit are enough for the season. The dengue season is mainly starting from June to January, but now in Hyderabad, you saw that the rain has been there till October. And post-rain is a time where there would be water clogging, the containers would be filled with water, and the dengue mosquito will be breeding there. And we at these 3 months, the purpose of launching this guide right now is that these 3 months are very crucial when we are fighting COVID, and we know that dengue is also going to be at the rise. So that's the reason we have launched it. So whatever we are providing in the kit, currently we'll provide it free to all the RWAs, 2 kits for the RWA. The amount of boric acid and temifos we are providing in the kit should be suffice for this season. But in case it is not, we can provide it more. Once you use that kit, if you find it beneficial, we would advise you to motivate other residents also to use the kit. There are many components in that which are for use within the home. So the activity involves the task to be done within the home, as well as in the corridors, as well as in the society open areas. The management tends to take responsibility of the open areas, but a large proportion has to be done inside the home. So for certain kind of activities like using DEET, mosquito repellents, using insecticides, impregnated curtains, meshes, window meshes, all those things, all the residents would also require to use it to have an overall impact. In that case, if and if other residents are also willing to join it. Sorry, can you mute, please, who is not speaking? Okay, thank you. So we would request the management to use these kits themselves, and if they find it beneficial and other residents would be interested in the components of the kit, the team will facilitate the purchase of those items on a subsidized rates. Lastly, the control room would be available for your service. Even if you want to do activities just by yourself, you may get some queries. You would like to understand few activities in detail. We would be available to provide any kind of support. And if you want us to do the trainings or any other activities which I've laid 1, 2, 3, where we can support you, all can be provided through the control room. All you have to do is just reach out to us. Control room also helps in coordinating the efforts with other agencies. So Dr. Murthy showed you certain pictures where GHMC had responded to the request of the residents. Mostly, if you raise your request at My GHMC app, GHMC has been very proactive, especially the entomologist, and they have taken their steps as requested. Where there have been certain delays, we have very good linkages with GHMC. We have partnered with them for this project. They are more than happy to provide any services, but they cannot come inside your homes unless a specific requirement is. In such scenarios, the control room can also help you to coordinate with GHMC to do any control measures required in your vicinity. It can be in residential areas as well as the offices you work in. In future, we are also planning to partner with certain waste management NGOs so that we can have a mechanism of proper waste disposal and picking up of the waste from your societies. That will be in the process, and we will offer that service as well, for a coordinated service as well soon if you would be interested. And any other kind of monitoring support that you would require if you take up these tasks in your societies, we will help you in how to go about it. All I want to say is before I close this talk is that it is not a one-time effort. Fighting dengue, fighting Aedes mosquito, or for that matter, any mosquito, is a repeated cyclical activities that it requires commitment for months in the peak season every year, and within that season also at least once in a week, because the way mosquito breeds, the eggs grow into larvae into adults within 7 to 8 days. Unless you do all those activities once in a week, we will not succeed. And as a society, all of us, most of us who can participate, should also try and engage other partners, other neighbors, residents, try to bring as many people as together. It is a community effort. Less can be done by governments, less can be done by the agencies like us. We can provide tools, we can bring them to your offices, your homes, but ultimately it has to be communities collective effort to do these things inside their homes, in their near vicinity, and bring about a change. With that, thank you all, and happy Dashera. And I'll open up for the questions if you may have any, and the panelists if they may have to add anything to the Shara theme and inviting everyone. Over to you all. So I request any participants, if they may have any questions, they can unmute and ask the questions, or write in the chat box, or raise hands. Our participants seem very quiet today. Are they the Shara celebrations, or some puri kachori, or some snacks?
Yeah, I think it is a heavy lunch.
Everybody is having some snacks with friends and neighbors. Great. So in case there are no
Uh,
questions,
Samiksha,
yes,
I think I just want to add that we are
please.
quickly coming in for a school program also. And all the participants who have joined today, if you want your children's school to be involved, and if you can share the contact details of the school to us on the control room number, then we will get in touch with the school. So please, um, and this will be an ongoing activities with the school. I am sure all of you want your children to be safe at school, and we are working with schools also to make school environment safe and raise awareness among students at school.
Right. Thanks, Rajan. That is important. And we'll soon launch the school program. We have kept a date for 7th of November to launch the school program. And we invite you all with your children's name, the school details. We already share the details we require through WhatsApp and Telegram group. Please do respond. We have to reach out to as many people, as many schools and students we can reach out to. Remember, schools are also a risk area where your students, where your children go and study. And soon, when the schools will be opening up, we would request that the schools also prepare and are safe from mosquitoes, and the students are aware how to protect themselves. Thank you for reminding that and bringing that point into the webinar today. Uh, Dr. Murthy, Shari, would you like to add anything before we close?
Well, as far as I'm concerned, I think all the points that were required to be raised have been raised. And I think on a festival day, and with the festivities going on over the next 2 days, I can understand that some of them would not have been able to join. And if you would want us to do a webinar for the resident associations, wherever you are staying, whether it is 4 houses in a complex or whether it is 1,000 houses, we are very happy to come there, talk to your associations, your general secretaries, your presidents, and help engage with them so that we have a vision which we can fulfill in just a year from now, and that is a dengue free Hyderabad. Let us all see if we can make that our vision to successfully launch in Hyderabad. So that's what I wanted to say, Samiksha. Back to you.
Thank you. Shari?
No, thank you. I just hope that whatever we learned in this program, we actively spread it to everybody else that we know. And so our dream is that we have a dengue mukt Hyderabad. So the next few months, a lot of your help will be required. So looking forward to that. Thank you.
Right. Thank you. And now with those words of inviting you all and with the pledge from at least from the Project No Fever team to take it and scale it up to larger number of people, we wish you a very happy Navratri and Dashera, and keep healthy, keep safe, and we'll join back soon. Thank you very much. Chaitanya, we shall close the webinar now. Thank you everyone for joining.